Well, I was trained in conventional medical school in New York, NYU School of Medicine, and did regular pediatric care. And what I ended up seeing was a lot of kids with asthma and allergies and seizures and fevers and all sorts of acute and chronic illnesses. And all I was taught to do was to treat their symptom or their disease. So I'd tune them up, I'd give them whatever drug or therapy that I was trained to give them, and I'd send them away. Then I realized that I kept seeing them over and over and over again. So it was actually out of my frustration of not being able to help them that I started to explore, well, what contributed to their current state of health or their current state of illness. There was a lot of what I was taught in residency was no longer coming to fruition when I was working in the ER. So I'd see kids with what I was taught were ear infections, and I was giving them antibiotics. And after 10 or 11 days, they'd come back to the ER and they'd be sick again. And I was taught they had a resistant bacteria that I needed to treat with another course of antibiotics. And so I'd give them another course. And at one point I started to realize, well, maybe my diagnosis was wrong. They kept getting sick. Maybe they never needed the antibiotics to begin with. And so in the year 2007 now, it's been over 12 years since I've used antibiotics for what is classically thought of as an ear infection, because I've come to understand that it's not an infection, that it's actually an inflammatory process.
Right.
And so if I were to understand what created the inflammation and assist the child in draining the inflammation, that they would actually get better and antibiotics wouldn't be necessary. Now there are studies coming out in the Pediatrics Journal and New England Journal of Medicine showing that if you give parents a prescription for antibiotics and ask them to wait 24 hours, at least 2/3 of them do not fill the prescriptions.
Right.
So there's precedence. The European literature for the last 20 to 30 years has shown that antibiotics are the wrong treatment for the first line treatment of children with ear pain. So now what I'm seeing is still kids with chronic illness, asthma, allergies, neurological challenges, so all the learning disabilities, the behavior problems, the attention problems, the autism, ADD, ADHD, Asperger's, and all of these children with 10, 20, 25 courses of antibiotics for quote-unquote ear infections by the time they're 3 or 4 years of age.
It's amazing.
It's
the amount of
unfortunate.
drug.
One, most of the time the antibiotics are not needed because the reason the children are having pain is because their ear canals are not draining the mucus. 2, the increase in the mucus is because there are things that are in their body that are creating inflammation, that are making the body produce more inflammation.
Like what?
Well, the most common things that children are exposed to that lead to inflammation are foods. And the biggest foods that I have successfully helped remove from children's diets and watched ear infections or ear pain go away is dairy, unequivocally across the board. Sugar is usually the second, although wheat is often a 2A, so to speak.
Right.
And I go to soy being up there with dairy.
Right.
So when I ask families to get rid of the dairy, which is not necessary for their bones, and ask them to reduce the sugar and watch the amount of flour and wheat that they eat, the amount of inflammation that happens in their body is less. Therefore, the amount of mucus that they produce is less, and therefore the drainage is better. So what I hope for parents is that they start to learn that all these quote-unquote ear infections are not infections. They are more inflammation that don't need antibiotics, that need better care, better drainage, and better diets and environments. And what I find is that children are not eating food, they're eating food products.
Right.
They're eating processed foods that don't contain the proteins, the fats, the carbohydrates, the vitamins, minerals, and water that their bodies need to function. I have clinically seen that children do much better in concentration, social interaction, and in energy, just feeling calmer when they're not bombarded with all those electrical outputs that are coming from the TV. So I think attention definitely. Often what I used to do is ask parents when they called with their child having ear pain was, are you near your craniosacral therapist, your cranial osteopath, your chiropractor? If you are, go there first and then come to me, and I'll take a look at the child. What I started to learn, even in the intensive care unit, was that children had the innate capacity to heal, knowing that that's the chiropractic philosophy, and then realizing that if I went back to my textbooks, anatomy, physiology, immunology, biochemistry, that all of what we were taught in medical school shows that the body is built to heal itself if given the right opportunities. And so I started to understand, well, what put the body in a place where it wasn't in the optimal health? I don't use any medicines in my practice. So I don't recommend over-the-counter medicines, and I don't write prescriptions. I don't work in an emergency setting, so these medicines and over-the-counters are not necessary. Again, there's a lot of resistance to changing the old guard. And in medicine nowadays, there's, well, how do I treat the child with safer remedies rather than how do I help the family get to a different place so that these symptoms don't come up as often. And so there are different practitioners who are along different levels of the spectrum in being willing to practice in different ways. And if you take the innate capacity to heal is within all of us, what we're seeing is that their bodies are attempting to create a certain level of balance, but they can't because either they're so overwhelmed or they're somewhat weakened. So the goal is to remove the things that they're overwhelmed with and to try to strengthen them so that they can continue to withstand the things that they are exposed to on a day-to-day basis. I was trained that the physician is the primary care provider of the child. And what I now understand is that the parent is the primary care provider of the child. I'm not there. So what I'm asked to do is to re-empower or remind the parent of their role and their ability and their responsibility, that it's not someone else who's going to rescue their kid.